What is it that practitioners need to be focused on to truly help these people in need? Cases are complex these days. People are really suffering. And there's a lot of folks out there who are claiming to be practitioners, health coaches that maybe don't have as much training as they need to really help people with these complex cases. That's what this episode's about. And I am super, super excited today to have as guests, I have Steph Jackson and Jennifer Whitmire. And a little bit about them, they are graduates of our nutritional endocrinology practitioner training. And they are both out there like with passion and love and compassion to help people and with skills that can help people. They don't just look at people and say, drink more greens and eat less gluten or whatever, which are great advice. But for most people, we need to go more and we need to learn more. So, what I want to do is have a conversation here, a really frank and honest conversation about what we need to be able to do and understand as health practitioners to truly help the people in need today. I'm going to just state a rant. There are lots of health coaching schools out there, and a lot of these people are putting out programs that are substandard. Hey, join my 30-day program and you'll become certified as a health and nutrition coach. And it's $97. I mean, I'm not judging it by its $97 price tag so much as what kind of quality can you be putting together to create somebody, and as a health practitioner, if somebody's going to just trust to help them with their most precious gift, their health. And they've had 30 days of training for $97, right? Would you go to a brain surgeon who did a weekend workshop for $97?
Like, not on my brain.
Not on my brain,
Yeah.
right? Would you do that with a heart surgeon? Well, your health, your biochemistry, your nutrition, your life, all of these things are what cause you to be able to be healthy. And that's what we as health practitioners need to be focused on is how can we provide the best possible care? We don't want the $97 brain surgeon. We don't want the $97 health coach. We want people who truly care, who truly are doing this because they care, but also had a deep understanding of how this body works. So Steph Jackson specializes in microbiome and the genetics related to the microbiome and how that all fits with the whole body and truly helps people to get to the heart of it. She healed herself from an autoimmune disease where she was laying on the couch in her 20s, right?
It was my 30s,
30s,
early 30s.
early 30s. She was laying on the couch and couldn't get up. And she was in a lot of pain and she was able to help herself because nobody else was able to help her. And Jennifer had an autoimmune. She didn't know it, but she's always been interested in health and nutrition. But the advice she was getting was like conventional medicine, eat your 4 food groups and eat lots of meat and lots of, dairy and all this. And she wasn't well, and she found out she had an autoimmune thyroid condition, and unfortunately, before she learned better, she had her thyroid irradiated, so now she's has to be relying on thyroid medication, but in spite of all that, she's turned her health around, and how did she do it? With the power of food, food as medicine, with the power of lifestyle, of stress management, so she specializes and helps people with autoimmune diseases and to use food as medicine, to use food for lack of breaking down inflammation. She's also an herbalist and all this. So we are uniquely qualified, I think, to address this. And I've been in practice 33 years as a functional health practitioner before the word functional health practitioner, functional medicine even existed. That's what I was doing and focusing on food and lifestyle and attitude and all the other things that make it. So what do you need if you're a health practitioner listening or you want to be a health practitioner, you're helping yourself and you really want to get into this as this field? What do you need to know? So what I want to do is I want to ask these wonderful practitioners, like what would they have needed or wanted from a practitioner when they were sick, like that they didn't get, that they now provide. So who wants to start?
Well, it was funny in the beginning when you said, would you go to a brain surgeon, a heart surgeon, or something that only studied for 30 days or a
Yeah.
weekend workshop or something. And I think that we don't take nutrition and food seriously. We don't realize how much that affects the
Right.
body. And we think that, well, you always talk about personalized nutrition and personalizing it. And so something can be a fabulous food, very nutritious, but it could be harmful for you. And so we want to make sure that we are learning about the different foods. So we're not just learning about, like I learned about the food groups, which I now had to unlearn. But we're learning about all these foods that, maybe they need to be prepared in a special way for you. Right. And so
Mhm.
like what my point is, we discount nutrition. We don't count it. And, you know, now I don't want you cutting into me with a workshop, but we also need to know more about nutrition, not just about the food. We need to know how it
Works
affects
in
our
the
body,
body.
how it's broken down, how it's absorbed, how we get the nutrients. It's not just what you're putting in your body, which is Steph can tell you all about.
And then there's the genetic factors, right? So
Right.
you have to understand that somebody may not process vitamin D properly because of some genetic factors. And, they're just,
Right.
you're showing a vitamin D deficiency, even though they're taking plenty of vitamin D. And medicine just discounts that,
Right.
Yeah.
right? It's just like, oh, they're taking plenty of vitamin D. Why should they be having a D deficiency?
Right. Or the advice is take this much or take that much, not how much are you absorbing, how much are you able to convert, and
Right.
how are you.
Right.
Yeah, it just doesn't make any sense. Actually,
Right. Yeah.
think about it. It's so important for autoimmune and
Exactly.
for gut health as well.
Right.
Right.
And
Yeah.
autoimmune, like both of these women had autoimmune diseases and they were able to reverse them, right? And autoimmune diseases are considered a life sentence by Western medicine, right? You just have it and you have it for the rest of your life. And you can take various medications to slow down the process or decrease the inflammation, but that it's not able to be reversed. And we see it all the time in our practices and with personal
In our personal.
experience, right? That it can be reversed and it can be, maybe it is put in remission. I don't care about how the terminology you say is,
Right.
because some people say, well, it's not really gone. If you go back and do the same things that caused it, it's going to get irritated. Sure, you have a weakness in your body that you're going to,
Hmm.
but if you break your leg by falling down the stairs and then it heals, and then you fall down the stairs again and break your leg, you're not going to say that, oh, the first time you really didn't heal it. No,
Right.
it's just you went back and fell down the stairs again,
Right.
right? And we
Right.
do that with our bodies all the
Yeah.
time, right?
Yeah.
So what do you wish you knew when you started, when you were laying on the couch and you were told you have this autoimmune condition and you're going to have it for the rest of your life? And I'm like, 30 years old, what the heck?
I don't know. To be fair, I already sort of knew because I had been through other things health wise before, and I had even been to sort of the more natural practitioners that would say, "Oh, you're sensitive to blah. Just don't eat blah and you'll be fine." And really that's not taking into account like the complex communication system that our immune system really is. And so I knew that I had to do it myself. And the signs that I saw when I went to try to get help, because, I was tired, I had a young child, and I wanted help. Really, I want someone to fix me. That'd be great.
We all
Someone could do the stuff for me. I would really like that. But so the signs I saw is I went to see an allergist, just like prick test kind of style. I was like, maybe there's just something that I can. And he said, well, you want it to be a food because that would be easy to control. I was like, you think food is easy to control? You jerk. But also on his wall, he had that's not the word I used at the time, but that's a nice word for this podcast. So then at the time, he also had this little sign that he printed up from his computer and had stuck with sticky tape to his wall, and it was like crooked and it said and faded. And it was like on one of those old printers that had the dots on the side. Yeah, and so it was like still on. It was just a janky sign, and it said, "We are not responsible for any changes in symptoms that occur following your visit." And I was like,
What?
"My doctor's not responsible for any change in the symptoms that occur following my visit." So I left there. Okay, and then I went to my rheumatologist like a few days later, and she was like, "Well, if you're not happy, you're gonna be sick." And she was like, "That's why I'm quitting this job." Okay, okay. I received this message loud and clear. I need to go do something myself.
Wow.
Ours the myself shit. It's
Yeah,
I can do
right.
something.
And it's true. Like I have this really cool poster. I should put a picture of it in the show notes. And it says it's like this cat sitting on the couch, and it's like got the pizza box and the TV remote and all. And it says there's nothing the doctor can do that will overcome what the patient will not. right? So
Amen.
it's really, as health practitioners, it's our job to empower people to do the things. Our job is to help them identify the things that are out of balance because they're not in a position to be able to do that. And we can if we have the right training, we have the right understanding, and we have the right compassion and heart set, right? Because we really have to care. But if they won't do it, if we say, really, we find that you're gluten intolerant or you're dairy intolerant or you're eating too much sugar or, the processed foods from the boxes with all that fat and processed fat, not good for you. You need to stop. And they don't know, what else can I do?
Mhm.
And I've gotten to the point, and, after 33 years of doing this, of saying, I hear you. And I don't have anything in my magic box. I don't have a magic box. I don't have a magic wand that can say to you that you can defy the laws of nature, defy the rule of gravity, right? And still get well. This is what I know. I don't have anything. So you'd be better off, sir, to try to find somebody who can find something else because this is all I have.
Right.
Right. And all I have is not to make light of it. What I have is an ability to teach someone and guide them step by step through a process to personalize what their body is missing, what their body is overtaxed with, and what they need to do to fix it. Right. But what they need to do to fix it, I'm not fixing them. But also, I'm not going to say, well, this is the protocol. Oh, you followed the protocol. Are you sure you followed the protocol? Right. Oh, and
Same.
well, I don't know what else to do, right? Just follow the protocol longer. Like you
Right.
had somebody say to me,
Yeah,
just keep
yes.
doing it longer
Yes.
and it'll stick in.
Yes.
But
Oh, this
there's
hurts. It means it's working.
Yes.
oh right, it
Yes.
hurts, it means it's working. If
Right.
you're telling people, oh yeah, you're gonna feel worse before you feel better. Sometimes that's true as a body's eliminating toxins, but it's your job to find a way to make them comfortable through that process so that they don't quit because we need them to see it through. But the other thing is, I don't like the word protocols. And my colleagues say, "Oh, a protocol. Of course, you have a protocol. You don't have a protocol. Each person is unique. So I can say there's a protocol for hot flashes. And if the protocol for hot flashes doesn't work for you, it doesn't mean that there's something wrong with the protocol. It means the protocol isn't the right protocol for you.
Mhm.
It's a plan for each individual, and it's got to be a personalized plan.
You're not like machinery.
Right. And maybe 80% of the people will do better with this particular protocol. But you have to be able to help that other 20% because most people can help the 80%. You got to be able to help the 20%. That's the important piece because those people are suffering and nobody's given them their due diligence. A lot of folks are relying on and even posting all over social media. There's a study that showed that. If you look at every study, there's never 100% of the people get the results.
No.
And what about those poor people in that, whatever, 20, 15, 5% even,
Yes.
2%, who we want to be able to help them.
Right.
And when you blanketly say like whole grains are great and it keeps your blood sugar steady and it helps your heart, sure, for maybe it does for 80% of the people. But how are you going to help that 20% where it doesn't? When you understand what's going on for them, right?
Right.
And those are the things we need to do. So what are the tools you wish you had? What are the tools you think practitioners need to have in order to help?
Well, that 80%, they can kind of go online, do some searches. They can read their own studies and they can go do those things and they might start to feel better.
Feel better.
Right.
Yeah, what about that 20%?
Right. They've been digging deeper. It's doing, like we were talking about before, we have to do that health history and really dig in and really go all the way back because childhood, even before you were born, we had, there are different things which is, why we are all so unique. We came from very different beginnings and then raised differently. And so it's really doing that a very thorough health history of everything. What's going on, what went on with your mouth when you were a child, very, very.
Right. And that's it. That's connection. People aren't even looking. Now we're starting to look at it more, but the connection between cardiovascular disease and mouth health. And how many of you like me had a mouthful of fillings by the time you were 10 and root canals by the time you were 20? And nobody's really looking at that as a risk factor for autoimmune disease, cardiac disease, even brain dysfunction, right? We're not looking at that. We need to. Right. And was there a mold environment? Did you grow up in the Northwest where it's very wet? and mold is predominating, or Houston or Florida or wherever, right? And looking at that, and no, I don't want to go on this bandwagon of everybody has mold disease or everybody has Lyme and that's the answer. No, it's going through and doing that thorough history. I remember doing a class. It was a 5-day challenge, and I was teaching practitioners how to really dig in the history. And I was like, one of the questions, which we all should be asking, is when was the last time you really felt well? And for some people, they'll say, when I was 23 and it happened, and you can find an answer, right? A reason. For others, they'll say, I don't remember ever feeling well. I was a miserably sick kid. So that's where you're digging. And one person who was doing this, I remember her specifically came back and she did the test. Like I gave them homework and she did this thing with her husband, and her husband went back and they figured out what was going on and why some of his problems had emerged. Right.
Wow.
Because she went back and he was like, finally said to her, okay, this health stuff you're doing, I'm ready for you to help me.
Okay.
Right.
Yeah.
So we need to really, and we have to have people feel comfortable with you.
Right.
But you have to, when you ask the questions, I hear this all the time. People say to me, nobody ever asked me that question before.
Yeah.
What a great question. And then we unlock prior sexual abuse, abandonment issues, or deaths in the family that everybody else glossed over, that they lost their parents and then they lost a grandmother and their body just shut down.
Right.
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 Right. So health history is a really important one.
Right.
Yeah.
What else?
A little testing. I hesitate to say testing because it's such a chasm that we might fall into here. But testing.
Right.
Yeah. And retesting.
Right.
Like protocol. Do something and then test it.
Then test
and
it to
see
see if it works.
how it did or how much it worked, or just try to take a more logical approach.
Or even digging in deeper. Like it's one thing to understand some different factors on somebody's blood tests, but understanding how they all work together. You can't just look at one lab,
No.
which is what I used to do when I was trying to take care of myself. I would do piece by piece. This one thing is out of range, and then let's just try to right. I gotta fix that one. Yes, instead of understanding that they're all
I have a problem with my one
Yes.
single thing.
yes.
Okay. So you told me a story recently about a guy who you started digging into the history in the labs.
Yeah.
Tell us about that
He was-
one.
He was the first client that I worked with, and it was, I think, our second meeting, and we were going over, I think, 3 of his labs, one of which he had just had done. And I was looking at some of his iron markers, not were they within range, because the only thing that was out of range was his hemoglobin and his blood iron levels were low. And they have been getting low.
Iron
lower.
deficiency anemia. Oh, yeah.
He's like, well, that's what he said. He's like, well, I really want help with this anemia. And I looked at that among some of his other markers as just his CBC, or Canadian CBC, which is, can I say piss poor? Are those?
Yes, you can.
Was that a swear word? So it's such like 2/3 of one page. It's even so limited. But looking at those markers and listening to him talk, I said maybe it would be good for you to go do a screening for colon cancer. And it turned out he did have stage 3 colon cancer. And and he goes every 2 weeks to the doctor.
And they missed
did having all these tests, and they were like, "Oh, you're getting anemic." Just they're looking at that one thing.
that one thing. And you were asking questions in addition to that. So
Well, I knew the pattern too, right?
Yeah.
Of the ferritin getting higher, and there's some more and more inflammation, and then there were some gut things. Yeah, I was asking questions.
you were asking questions, right?
Yeah.
The power of questions. You
Yeah.
cannot underestimate the power of questions. You cannot, the kind of medical model we have gotten to is the short visits. I know in the UK, one of our graduates was a doctor in the UK for 20 years before she came and studied functional nutrition and in nutritional endocrinology with us. And for her, it was 9-minute visits, literally 9 minutes, and they were timed. And she had her hand slapped quite a number of times for her visits going over. How do you really connect with the person, make them feel safe, because safety is a critical component of healing, and then find out what's really going on, and then help them, give them some action steps, right? How do you do that in 9 minutes?
Yeah, you can't.
Well, I don't.
Yeah.
I'm so sorry. I don't think that's the goal. especially when you're only supposed to address one issue at a time. Like, what's your one issue?
Right.
That's
Right.
not a
No.
thing.
Right.
Yeah.
No, it's not.
So
Right.
you can come and say, I have a runny nose.
Oh,
That's
okay,
one.
here.
Yeah.
Yeah.
Right?
Stop the
Well,
runny
why do you
nose.
have a runny nose, right? You always have to ask why and keep digging to why. Well, why is that? And
Yeah.
why is that? And why is
Right.
that? And why is that? So you get to the basement,
Yes.
right?
Just keep asking why
Why?
until there's something that
And then you
have
have,
an very
okay.
Yes.
So that causes this, and that's how you get to the root cause. And I know root cause is overused these days, but we really, there's no one root cause, no, ever. It's usually multiple root causes.
Yep.
The root causes may be gone right now, but the symptoms and the damage that was done internally from those root causes can still exist.
Right.
Yeah.
So that's what our goal is, to find out what those root causes are, make sure that whatever those conditions are that led to that are gone, and then work at damage control. What's out of balance that we can help them put back in balance. And it's a synergy, a relationship between practitioner and client or patient, however you call it, whatever your licensure is. And you're making some suggestions. They're telling you yes or no why they can't. If the why they can't is like usually excuses or whatever, then your goal is to really coach them and be there and encourage them to do the best things. And then if they say, yeah, I'm going to do that, it's to help them with how and be very encouraging when they do it. Yay, we did it. And celebrate the wins. So there's a lot of little nuances here that I'm sorry, but I don't think you can learn in a 30-day, $97 health coach certificate.
Yeah, I really don't think so. I mean, even in 4-year programs, they're still doing what I like to call root cause mistake, right? Where they think there's a root cause, first of all,
Right.
and that if you take that out, that it's fixed.
That it's
Right.
fixed.
But
Kill the bug.
even with, like get rid of this bacteria in your small intestine and that'll be fine, or get rid of this, whatever. And there's some kinds of signaling in even immune system wise that
Yes.
just will continue
Yes.
unless pattern changes,
Right.
not you take out gluten and you're healed.
Right.
Yeah.
Right.
Right.
It's a lot more than that.
And there's a lot of that. And yeah, we do see miraculous results sometimes when people take out gluten or dairy or sugar, whatever. You take out those pieces, and sometimes we don't. But it depends on how many fillings are in the foot. So Dr. Bredesen talks about with Alzheimer's, like the fault of medicine is looking for the cause and the cure. And they try this medication and that medication, and none of the medications work because he said there's 37 holes in the roof. And if you just try to fix one, there's still going to be rain coming through.
Yeah.
And that's what happens when you try to address one cause of a very complex situation. And so I don't want to discourage you from your role as a health practitioner or making it, oh, that's too hard, I don't want to do it. But yeah, it is hard. And yeah, you need to understand all of these pieces and be good at connecting with people. That's a big fault in Western medicine. A lot of times people say, well, I go into the doctor and they go, brr. My husband had that situation with a Achilles thing, and he had, was wanting to go deeper. Like it's still there. And it's like, it's just an Achilles tendonitis. Just go do physical therapy.
Yeah.
And he felt so discounted. And he's like, are you sure it's not some sort, I read about this particular type of tumor or this particular kind of thing. I want to know, are you going to do some imaging on it? It's just an Achilles sprain. Right. And he felt the bedside manner. He was like, I'm just trying to figure it out. I don't want something to bite me in the butt, in a couple of years and find out that I've been treating it as an Achilles tendonitis and it's really a tumor that we could have caught early,
Right.
So those are the sorts of things. So we have to listen to people, listening and questioning, and making them feel honored with their symptoms.
Yes.
Yeah.
And if it's on brand to, instead of treating things as if there's something that happened to the person, empowering the person to change the patterns that are happening every day in their body.
Yes.
So instead of like, oh, this all happened because you were exposed to H. pylori on your vacation or whatever, it's still, there's still with the root causing, there's still a little bit of, it happened to me. It's a little, I don't want to say victim because that's not what I mean, but it's really disempowering.
It's disempowering.
This thing happened and it made all these things happen, bad things happen to me, instead of, what is my body doing right now? How can I work with it to be as healthy as I can be? Just a total change of,
Yeah.
and that takes, that takes internship, that takes practice, that takes
Yeah.
learning. It's not
Yes,
things
it's not
and
something you learn in a 30-day
No.
coaching program for
Yeah.
$97.
No.
Sorry.
Yeah.
I mean, I wish it was easy. If it was easy, there'd be a lot more people
Right.
doing a lot better. But it's not. It's really a complex relationship that you have to be able to develop with the person, with them, with their emotions, and be able to understand that all of that factors in. And how are you going to help and be the one? I've had people call me a miracle worker, and I always say, no, you're not. I'm not a miracle worker. Your body is a miracle worker. I'm just here to facilitate that miracle that's in you and empower you to get in touch with it and do the actions you need to do.
It's the only thing that ever heals.
Right.
I feel like the Band-Aid's not fixing
The Band-Aid didn't fix the cut, right? The cast did not
Yeah,
heal
that's
the
not
arm
healing.
that's broken. It's the
Yes.
healing. It just the Band-Aid or the cast or whatever just keeps us from further injuring it. Right?
Right. Yeah, the body can heal itself.
Right.
Yes.
Right. And if you take out a tumor, sure, the tumor isn't there. But what about the cause of why you developed that tumor? You didn't fix that if you just took out the tumor.
Yeah.
There's a lot more to do. Yes, sometimes you need surgery and you need to take out the tumor, or you need chemotherapy or whatever you need for life-saving situations. But what are you going to do to prevent it?
Yes.
Dr. Lodi says, stop making cancer. What do you do to teach your body to stop making cancer? Because it's just going to come back. We know that.
Yes.
We know that if you just deal with it, it comes back.
Right.
In what, 98% of the case, I don't know the numbers exactly. I'd have to look those up. But in a large percentage of the cases, you just remove the thing, comes back because you didn't remove the underlying cause.
Yeah. Or the environment.
With the environment that made it happen, that made it easy.
Yeah.
Right. They want
Being an autoimmune disease.
an autoimmune disease. So let's talk about autoimmune disease a little bit.
Yeah. Well, in a lot of cases, like I had my thyroid irradiated, but in a lot of my clients, they have their thymus removed. Right. And so we have a lot of immune system things there. Right. And so that doesn't reverse your autoimmune disease. That doesn't take the autoimmune disease away. It's just removing whatever's being targeted at the time. And so it doesn't stop any inflammation. It really doesn't get down to the reason. It wasn't because all of a sudden the thymus was out of control or the thyroid was out of control. It's something else. What created it to begin with?
So what do you think would be different now if you knew then what you know now? What would have happened differently?
It totally would have changed what I was eating.
Mm-hmm.
And I would have, well, I don't know if I would have at the time. Hopefully I would have tuned into like meditation and things like that. All the pillars, like your freedom pillars. I would have known to go through those, right?
Yeah.
And really hone in on where am I missing?
We're missing pieces.
Right.
Right. Do you think you could have avoided? I mean, we can't. Yeah, you think you could have avoided?
Yeah, I think I could have avoided it.
Yeah. I mean, we've seen a lot of autoimmune diseases reverse themselves when you hit it early enough, right? You can't do it after 30 years of having your thyroid antibodies killing your thyroid. Maybe it's too late.
Yeah, and it just switches you from one autoimmune disease to another autoimmune disease.
And that's a really good thing to remember. As a practitioner, somebody comes in with one autoimmune disease, they've been diagnosed. Likely there are 2 or 3 others that are either brewing and are going to be manifest and diagnosable shortly if they don't change what caused the first one, or that they're already there. They just haven't been tested for because they're not symptomatic yet. And what I see sometimes is I see people, I do thyroid antibodies on everybody, thorough, a full thyroid panel, not just TSH, because where they got that idea that TSH was the epitome of it. TSH is a hormone, as you should know, is it produced in the pituitary and it stimulates the thyroid stimulating hormone. And if the thyroid's not responding properly and producing enough thyroid hormone, it goes up and up and up and up and up because it's like, come on, make it. But that's all that Western medicine looks at. Sometimes the TSH doesn't go up or down, yet the thyroid hormones themselves are out of balance. Or a couple of things, and this is just a little tidbit clinically that you should know about thyroid, is that a lot of folks have difficulty converting T4 to T3, inactive to active, mostly active form of the thyroid. What's the cause of that? Well, it's stress and cortisol elevations and lack of certain nutrients and all that. But also the thing that they're missing is the receptor resistance.
Yeah.
Like every cell in the body needs to be able to say, oh, thyroid hormone, let me take that. And if it can't because of receptor resistance, and there's a bunch of things that go into that, we teach it in our thyroid classes, but people aren't looking at that. And that's like kind of a occult cause because there's no test for it. Oh, let's do the test for thyroid resistance. There is none, right? It's like we did all this, and yet they're still showing signs of thyroid being low. Your blood can be perfectly fine, right? But your body is going, I don't have enough thyroid hormone, right? Those are all the things that as a practitioner, you need to be able to be astute about and be able to look at.
Right.
And that goes back to you saying the testing, the right testing. They're not just like, I tested TSH and it was fine.
Right.
I've seen a lot of people who we test the thyroid antibodies and they don't show signs of thyroid imbalance, but their antibodies are elevated.
Right.
That's a great time to catch them.
Right.
Right?
TSH is, again, in Canada, it's one of these, the only thing we can get. And like it's a zinc dependent feedback loop. So the pituitary won't really know if we have enough active thyroid hormone without zinc. And how many of us are deficient or have what is
ready
right?
most common.
Exactly.
Yeah. So should we just supplement with zinc?
No.
Thank you. We can have a better test. So like, yes, right.
Yeah, do better testing, right? So you're hearing this, you may be hearing this and thinking, well, I'm a medical doctor and I never learned this stuff in medical school. Right. That's the problem, right? We have a medical education it's a very pharmaceutically oriented, right? And if there's a medication for it, we're going to diagnose it, right? And I'll give you an example, lipoprotein little a. It's just now becoming on the market where people are going, oh, I got to get that tested. Why? Because the drug companies are this close to releasing a drug to lower it.
Oh, really?
I didn't know that.
I did not know that.
But up till now, they haven't had a
I thought
drug.
we were all just getting smarter.
No, we're not.
No.
They're just talking about it more because there's a drug that's on the market, on the horizon. It's in clinical trials right now. And once that's there, everybody's going to want to test LPA because we can treat it. What do we test for things in Western medicine that we can treat, that we have a drug or a surgical procedure or some kind of procedure to treat it. We look for, as a functional practitioners, we look for imbalances in the body. And some of those imbalances are going to indicate imbalances now that could be diseases later. And I always say to people, do you want to get a knowledge about something going on in your body that's already a disease? Or do you want to find out that there's some imbalances that could be leading to a disease further down the road? Everybody without fail says, of course, I want to know beforehand. I don't want to have a disease that has to be treated.
Right.
Yeah.
Right. So those are the things. And, so if you could give our listening audience advice, whether you're a medical doctor, a nurse, a health coach, a osteopath, a chiropractor, a naturopath, I'm thinking of all the different practitioners that come and do our programs with us, herbalist, chef, culinary whole foods chef, whatever your background is, I take it that you got into this profession and you're listening to podcasts because you want to be the best you can and you really want to help people. And you're feeling like some of the tools you have in your toolbox are not quite adequate. So what could you say to folks that are in that situation that are listening?
Well, recognize that every person that you see is a completely different person than the one you saw before. They may have the same symptoms, but it could be a completely different case. And so it really is digging into the history and looking at them as an individual.
Yeah. Great. Yeah. What'd you say?
I would say help people to learn about their own body one step at a time.
Right.
And there is no one root cause.
There's no one root cause, right? And there's no one magic supplement. And I will say, most people are out there. They really want the education. They're going to blogs, they're going to podcasts, they're going to summits, and they're getting confused because everybody has a slightly different plan and everybody has the answer.
Right.
If people are telling you they have the answer,
Red flag.
away.
Yeah.
Yes.
Or if you everybody needs, as soon as this is needs.
Everybody needs this supplement or this powder or this detox. That everybody needs to go through this particular type of detox program.
Or we all need to eat broccoli.
Or we only
love
do
broccoli.
broccoli. I do too, and I think it's a great food.
Yeah.
But some people right now do not have the mechanisms to break down broccoli. Maybe they're oxide sensitive, and maybe they're I don't know if it's FODMAP, but or nightshade sensitive, or I don't know, whatever. They might have problems in their body with really utilizing that food, and we can't just tell everybody that that's the food for them. We have to go through, and I'm personally think we should be looking at why they don't tolerate that particular food and how can we help them to rebuild
So the
so that they
balance, yeah.
can, right? But temporarily avoiding foods that you're sensitive to, we're big on, right?
Yes.
Do an elimination diet, figure it out, heal the gut. Last thing I want to just say, I know we could talk for hours. We could
Yes.
be here for hours
Yeah.
with you guys, but we're going to cut it shorter. What's the role of the gut in inflammation and autoimmune disease? Coming back full circle to you both started out with autoimmune disease that got you interested in this line of questioning. What would you say? What's the role of the gut?
I would say the gut is the communication center for where we take food from the outside world and bring it into our bodies.
Yeah.
And our immune system and the bacteria and the postbiotics, the things that live in there, and the foods that we bring in, it's all chemical signaling between our immune system and those things, be it the bacteria or the food. And this helps us to know whether we're safe, whether we must upregulate or downregulate certain inflammatory signaling. And yeah, whether we're building or whatever we're doing with our gut lining is really, really important. And to think about what we're putting in our bodies and maybe to move a little bit away from our defense system protecting us against bad things that happen to us and more toward optimizing the digestive environment
Yeah.
for health.
Right. It's doing its job. Your immune system's doing its job in autoimmune disease. You just have to figure out what it's fighting against.
Right. What's going wrong?
What's going on.
Right.
Yeah.
Right.
What would you say?
Yeah. Well, with autoimmune, I immediately think leaky gut. I don't know if it's 100% or not, but we need to look at the gut and need to ask about bowel habits. Just in our investigating, I mean, we get down and dirty.
Yeah, and dirty.
Yeah, that's what we need to find out what's going on, right? Because if we do have damage in the gut, then we're not absorbing the nutrients. And I could be giving someone all the supplements in the world and they're not helping their body at all. And so it's really
It's a key place to start. And a lot of people don't, right? If somebody goes to a conventional MD and they get a diagnosis of lupus, what are they doing? They're looking at anti-inflammatory medication, right? They're not looking at what's going on in your gut, right? There's a process. I have a framework for going through all the things that need to be balanced to help somebody with an autoimmune disease. And it starts with the gut, the stress, external stressors, physical stressors, and mental, emotional stressors, right? What's going on with that? How's the blood sugar, right? How's the thyroid functioning? If thyroid, all of this stuff needs to be looked at. So it's a thorough investigation, not just to what do I do for hot flashes? What do I do for autoimmune? There's no one protocol for the condition. It's a plan that you put together for the person, right? Oh boy, so much we could talk about, but let's just end with one word of advice that you would give a practitioner who's either in medicine trying to bridge the gap and do things more holistically, functionally, or a health coach who's been trained pretty narrow range of stuff. What would you say?
keep asking why.
Keep asking why.
Yeah, mine was listen.
Listen.
I make it one
Yes.
word.
If it's one word, let's do it.
Let's
Listen.
bring in
Why and listen.
Yes.
Ask why and listen, right? So those go together, right?
Right.
Yeah, ask why, then you have to listen.
Yes.
Listen with that astute ear. The way that Steph listened for this guy with the colon cancer that had seen all these doctors and nobody picked it up. And he did turn out to have colon cancer.
Yeah.
Right.
So also trust your
Very-
instincts.
Yeah.
Trust your instincts. Wow. I'm dedicated to helping change this paradigm of medicine, right? To make it so that everybody out there, everybody who's a health practitioner of some sort, is out there looking for root causes and helping each person and empowering each person to go beyond that and to make changes in their diet, lifestyle, attitudes, everything, habits, so that they can be the best version of themselves. So just shameless plug, both of these guys are graduates of our Nutritional Endocrinology Institute. So you're welcome to go out and check that out. In the show notes, we'll have more resources and check out what the work that they're doing. because they have some amazing resources to offer people between the Culinary Institute and the
Join my microbiome club. It's really fun. The Friendly Flora.
Friendly Flora Collective, right? Her microbiome membership, where people learn how to actually get their flora, their gut microbiomes back in balance using delicious foods. So thank you for being here. Together, we can transform health for ourselves and for our clients. If you enjoyed this video, like, subscribe, and check out our other videos on metabolic health and hormone balance next. I'll see you on the next video.